everyone, welcome to another session of Informally Formal. I'm very excited as well as I guess saddened by the fact that the pandemic all over the world is erupting. Whether you call it the second wave or the third wave, I don't know, but it's all around. You know, we see the number of cases going up drastically. To some extent in Bangladesh, it hasn't quite happened as much, but we see a tremendous resurgence all across the United States and Western Europe as well. So to talk about that, we have someone who is a frontline doctor in the sunny state of Florida, Dr. Rumi A. Khan. Welcome to our show. First of all, give a brief introduction as to what you do so our audience knows that we are talking to an expert who's fighting in the front line. Please, welcome, doctor.
Thank you, viewers. Good morning, Mr. Akber. Nice meeting you, and thank you for inviting me. So my name is Rumi Khan. I'm a physician in USA. I'm practicing here since 1989 as a capacity of physician. I trained in internal medicine, then I specialized in pulmonary critical care, neurocritical care. So I'm a specialist in neurocritical care, pulmonary, and critical care medicine. I currently am a senior physician, pulmonologist, intensivist, ICU specialist, and associate professor in a medical university here. I also teach residents and fellows, train them, and I have been seeing patients with COVID-19 pneumonia and its complication since the day one it inflicted our state.
Right. Doctor, let me first and foremost ask you, the last quite a few days in America, and you know, my family lives in America, as a matter of fact, in Florida. So it's very alarming because we have seen now deaths approaching close to 2,000, infection rates approaching 200,000, has been over 100,000 for about 10 days, 2 weeks almost. Doctor, where do you see it peaking? One, and of course, then I would like to ask you about the different vaccines, that ray of sunshine, so to speak, that we're hearing from Pfizer, you know, and other pharmaceutical companies. So two things. One is, where do you see it peaking and then hopefully declining? And then, of course, the vaccine front, if you would address those two for our listeners.
I think finally in 10, 11 months of its existence, we have a clear picture, a clear vision of the end game, finally. So when it first hit, we didn't know how bad it would be hit, how bad it would be the first wave. That when first wave was at its peak, we have been skeptical, we have been afraid, we have been fearful about the second wave. Now second wave is on most of us, and some people are still having first wave, but due to a couple of factors, three factors, we are seeing that an end to the peak and slow decline over time period. What will happen is that the way it looks like during the holiday seasons, it will pick up, and after holiday, 2 weeks after holiday, January, up to January, we'll see cases rising, cases peaking. And by end of January, what I am expecting, there will be two things will happen. One thing will be, there will be at least, by the time 60 million Americans will already have been infected with COVID unofficially. They have some sort of immunity in them. That's one group of people who are protected. Second group, there will be about 50 million or more, or even 100 million Americans who will be vaccinated by January or February. 50 million Americans vaccinated, and there will be some overlap. 60 million Americans already immune. So if I even think about 60, 70 million Americans already immunized who are on the outdoors, that will start slowing the spread down. And by February, March, we are thinking a little bit, some more people getting vaccinated. So we'll be seeing more and more people are protected. So as a result, the spread will slow down. We are not yet there at the point, we will not be there herd immunity by numbers, but it will be enough immunity to slow down the spread. So after this winter, we are not expecting a third wave. So we're expecting a probably slow and recovering spring and a completely normal summer, 2021.
Right, right. Doctor, herd immunity, if I understand correctly, they're saying, experts are saying, is at about 70% of the population. So that would put the numbers at about 220 million or so in the United States. And based on what I've also heard, that by the end of December, we should have about 50 million doses ready by, the two companies that have asked FDA for emergency approval. Now, am I correct in understanding that there are two doses, the current vaccines that are going to be available, that you need two doses? So 50 million doses means only 25 million people will be able to be vaccinated. And we are also hearing that, of course, the frontline workers are the ones like yourself, should be the ones that are in harm's way, should be the ones that should be vaccinated first, and then perhaps the ones, elderly people in hospice care, long-term care facilities, and then the elderly, perhaps something like that.
Yes, 50 million people dose available at this point. By the time, if it is approved tomorrow by FDA, they will be able to start shipping out the 50 million doses day after tomorrow. So between two companies, Pfizer, BioNTech, and Moderna, there will be 50 million doses currently available at this point. 50 million will be good for 22.5 million people, because one person takes two doses. But by January, there will be 100 more million doses.
Right.
Only from these two companies. But also we are expecting two other better vaccines to come up, even better than this. Those are one shot, one dose, not two doses. One from Novavax, another German company, and one from Johnson & Johnson. Those are to one dose, one shot vaccine. Those are much less, their cold chain requirement will be much less required. They apparently are giving better immunity protection. So those two come up by early next year. Then by spring we'll have enough powerful and one dose vaccine to cover the whole country. So right. A vaccination and previous immunity, if we even collectively, we will not have to reach 70%. If we reach 30% of the population, the active population, outdoor interactive population, it will not give us herd immunity. It will slow down the disease process. It will slow down. And right. The more people get immune, it will be getting vaccinated, the disease will be slower and slower. So absolutely. I'm seeing a spring of recovery and summer of complete return to normal. That is the end game we have envisioned at this point.
That's a very encouraging, doctor. I'm very glad to hear that. You didn't mention the one collaborative one that they're doing out of UK with Oxford University.
That is Oxford. They have a AstraZeneca. They're another major vaccine. They are already preparing hundreds of millions of doses in India, in the Serum Institute. They're using Indian facilities for high volume production. Right. We will know the result of the phase 3 trial by the end of next month, by end of December, by Christmas. And then also by January, that will 100 million doses. I think those will be mostly used in Europe and in the third world country, because many third world countries already are purchasing from this AstraZeneca. So that is also will help global control of this virus.
Doc, let me ask you, one of the things that has people worried about the two vaccines that have been announced is the fact that they need to be carried at minus 70 degrees Celsius, which is would be a rather difficult thing for a third world country or an emerging economy where such storage facilities are not necessarily available. Challenge for even America. But then again, I hear that some of the other vaccines, and you probably would be able to tell us better, the one from AstraZeneca perhaps is going to be, will not have to be stored at such low temperatures. Your thoughts on that, doctor?
The thing here, the two vaccines we have now completely ready for approval, Pfizer and Moderna. Pfizer needs a minus 70 degrees centigrade freezer, but Moderna does not need. Moderna can go up normal freeze, okay?
I
And
see.
Pfizer is, how they are doing it, they are preparing a freezer briefcase. They will make a dry ice freezer. Vaccine will be in the -70 in the briefcase. That's how they will be transported. They will be sold. They will be distributed. Even if you buy 1,000 vaccine in a briefcase for your hospital, for your clinic, you buy it, you take the freezer, you open the freezer, take the vaccine out, close the freezer down, a briefcase down, vaccine stays in -70. So you don't have to purchase any instrument. The whole vaccine comes in a -70 briefcase.
I see.
So
I
that's
see.
how Pfizer is trying to solve the problem. It makes the vaccine a little bit more expensive, but that is nothing compared to the vaccine cost. Pfizer, they have this, they are already partnering with UPS, FedEx for the last few months. They have the freezer farms and freezer trucks. They're ready to drive. And this Pfizer freezer briefcase, that is makes it very handy. But
Right.
two other vaccines that are coming up next, big vaccine in America, Johnson & Johnson and Novavax, they will not require -70.
Okay, wonderful. Doctor, I have to ask you, so we covered the vaccine front. It looks rather promising with all the news that we hear, hopefully. And the other thing, of course, we have to reach a vast majority of the world. It's not about, that we have people immunized in the United States or Europe. That's good enough. In this interconnected world, if we don't eradicate it, per se, have people immunized and stuff, it can again spread like wildfire. Isn't that right?
I think it will be. There is so much fear, stigma, so much awareness about this vaccine. Although there always are vaccine naysayers, there are enough people who will get immunized either by vaccine or by infection. We will achieve the herd immunity goal vaccine intends to do. I am hopeful.
Doctor, let me ask you, in your medical opinion, what do you think is the reason why? Initially, when this pandemic started, we were under the impression that a highly populous state like Bangladesh, it would be a disaster. But, we are very thankful. We're very thankful that that hasn't happened. But in your medical opinion, what do you suppose is the reason why it didn't quite spread like wildfire in overcrowded places like Bangladesh with not enough resources, medical facilities and stuff?
Bangladesh, now we are in a second wave now. I am seeing that, and I'm seeing more people are dying. So we are not out of the woods in Bangladesh. We may see words coming in the next few weeks to months, especially in this winter season, all the wedding season, all the outdoor partying, all the picnic, all the social gathering season. It may make it worse unless we really take very strict social responsible measures to stop further spread.
What is amazing to me, Doc, is, most of my adult life I spent in America. And I would have hoped and would have loved to have seen a more social responsibility, I would say, in America. But it just seems like, I could understand in Bangladesh where people perhaps are not quite that aware, or more rural population and what have you. But it's pretty amazing that we see more masks here in Bangladesh than we see in gatherings in America. So that's pretty strange.
Yeah, Bangladesh people are more aware. I'm not sure. Yeah, I'm Bangladesh educated people in the little bit educated class people. They are being very, very responsible. But in outside public gatherings, I'm still not seeing much of a mask wearing public buses, where a little bit probably the lower echelon of the people uses public transportation. I don't see much of it. The awareness there, but the enforcement or the willingness to compliance is not there.
Doc, let me ask you, 100 years ago, we saw the Spanish flu. And of course, medical science has come a long ways in 100 years. But what do you see as parallels between those two? The pandemic of the Spanish flu and the pandemic of 2020?
The parallel, to be frank, the 100 years has moved on. 100 years have happened. but it says that we are so helpless in front of nature. Our science, our technology, our resources, our knowledge is so much, so vastly improved 100 years. Still, we are totally helpless in front of a natural phenomenon like this. This Spanish flu ravaged for 1.5 years, 2 years. At the end of the day, if you think in retrospect, a few years down the line, you think same amount of time this COVID will do, same thing. Probably at the end of the day, the lives lost, but the life lost now, the economy lost, will maybe comparable. So whatever we do, we need to keep respecting the nature. We need to keep respecting the force of nature. We reckon with that force, and we need to live. We need to live to know and remind ourselves, humble ourselves that how helpless we are, and that's why arrogance is not the right thing. We need to keep a safe distance from natural harms. We need to let nature be preserved, and we should not encroach on it. That's why we are seeing so many spillovers, because we are spilling over. We are interacting with bats, interacting with other animals that we should not be. We are invading their habitats by rampant urbanizations. In Bangladesh, there's a thing called Nipah virus. That is another major time bomb waiting to explode someday. It is showing spillovers every now and then. Thankfully, it is stopping in the second cycle, the first generation of spread. One day it can mutate and spread like this one. It may kill half the population because Nipah virus is very fatal.
Right. Doctor, Nipah virus, just for our audience sake, very quickly, Nipah virus comes from which animal or?
It is a bat-borne virus, bat-borne virus, bats and bat. It happened mostly in Bangladesh and India. It first discovered in Malaysia, but Malaysia they have got it drastically. It happened in Bangladesh in only world. Bangladesh happening every other year winter. Occasionally India, West Bengal, or in South Kerala. The whole world, the virological top lead, they're all focused on Bangladesh about Nipah virus. The top virologists, they're all stationed in Bangladesh to work Nipah virus. What happened is one of the sources of virus, people like to drink raw date juice, a khijure rosh. The bats at night come and suck the same juice, and same juice people drink in the morning. That spread the bad virus to human. That's the one way, raw date juice.
I see. Very, very scary indeed, doctor. I couldn't agree with you more that we need to be respectful of nature. We got to leave nature alone, and when we invade, natural habitats of animals, there is this crossover that takes place, and nature has its own way of dealing with such encroachment, I should say. Doctor, I know you're pressed for time, so with an invitation to bring you back perhaps at another time. Doctor, it's so good to have you. I cannot thank you enough for your precious time. I know, and my, salute to you, the frontline workers. You put your life at risk every time that you go in service of people like us. So I cannot thank you enough, and the likes of you that are in the front line. Doctor, with those words, thank you again. And I'd like to thank our audience for joining us for this very interesting conversation with a frontline doctor who puts his life at risk every time he's out there. So join us for our next session. With that, stay safe. Bye-bye.